Hi, I'm Dr. Kalika, and I want to talk to you about ESWT, which is extracorporeal shockwave therapy, also known as shockwave therapy. So that's the device we're talking about. So shockwave therapy was invented in Germany about 35 years ago. It was invented for breaking the kidney stones. Later, about 25 years ago, the orthopedists in Germany started to use it for different types of tendon conditions and muscle conditions, and it proved to be very effective. It came a little bit later to the United States, and today it's widely used. So what exactly is shockwave? Shockwave is a sound wave that's naturally occurring in nature. So if you hear a thunder, and after thunder you hear a deep sound, like almost feel like the earth is moving, that's a shockwave. So the shockwave, I've been doing shockwave for 10 years. I've probably seen, many thousands of people with different tendon conditions with lots of success. And this is probably one of the most successful treatment when the physical therapy fails, or a treatment that needs to be done in conjunction with physical therapy. I know there's a lot of buzz today in the media, and you all heard about plasma injections and stem cell injections, but so that you know, shockwave therapy has a lot more research to back up its effectiveness compared to those treatments, and shockwave therapy is not invasive and barely painful. So what we need to talk about with shockwave is why you do shockwave. But I think first that you want to know what condition shockwave is good for. Shockwave is great for myofascial pain, any pain stemming from muscular trigger points. Shockwave is great for tendon issues. Tendons such as Achilles tendon, any tendons on the foot, tibialis posterior, peroneal tendons, your tennis elbow, your plantar fasciitis, some of the shoulder tendons with good success, and also hamstring, and pretty much all kinds of tendons. Now, the success of shockwave for the tendons is better than with any other treatments, as I mentioned, but it really depends on tendon location and the application of focused and radial shockwave. So if you look at the device, you will see that the device has two heads. One is radial, the other is focused. And the radial device is not a true shockwave. The radial device is a pressure waves. All the people call it shockwave, but it's really not a true shockwave. So the radial device can also work for tendons, but not with such efficiency as the focused device. Also, there are locations on the bony places where it's really impossible to do the radial because it would be too painful. Also, radial doesn't have the penetration that the focus has. I can penetrate up to 7 centimeters into the body with the focus. I can focus the energy to much smaller, so I can affect the tissue much more precisely. And I tend to call it, in the last 3 or 5 years, I tend to call this procedure an ultrasound guided shockwave therapy, because the better I got with diagnostic ultrasonography, the better my shockwave results started to become, because I can focus exactly on the depth and precisely on the tissue that I can affect. And why we need ultrasonography? Because if I image with the modern high frequency ultrasonography and with the ultrasonography machine like this that has microvascular imaging and elastography, which is totally new development and very few machines have, but I'm lucky to have this beautiful device. So with SMI, which is microvascular imaging, what we can see if there's really beginning of inflammation, which cannot be seen on Doppler imaging with normal machines. And if I see the microvasculature flow, I can say whether there's more inflammatory component or less. And that guides how I use the shockwave and where, and how many treatments I have. With the elastography, which is also part of this beautiful machine, and elastography is a tool that can show us show us tissue density, tissue elasticity. Sort of like if you would palpate with your hand, you would feel something is thicker or more sticky or not moving or tight. This can show me in colors and in numbers exactly how tight that is. So if I look at the tendon, look at the tissue, I can see exactly where that tightness or loss of elasticity is. I can do the shockwave and measure within a matter of minutes, measure if the shockwave affected that. So that's why ultrasonography is really a beautiful combination with that. And the other thing to know is how it works. So shockwave therapy is a sound wave energy that penetrates the cell and create a reaction that causes neovasculogenesis. And neovasculogenesis is a fancy word that pretty much means that there's new ingrowth of blood vessels in the tendon area that has no blood, because tendons are known to have very poor blood supply. So by bringing more blood to the area, we're actually creating healing. So all in all, shockwave therapy is a successful procedure that I've been used and hundreds of thousands of doctors all over the world use today. And it's fast, it's effective, great combination, and fantastic procedure that I enjoyed over the years. Thank you so much.